Dr. Zymantas, what do you think about, the old silver/amalgam fillings versus the new one? And especially, what do you think about if you have old ones in it, in terms of taking them out or not, or replacing them? I'm sure that most dentists put, the new ceramic type of, or the whatever, fillings in almost all the time these days. But what about the old one? There's lots of controversy. Can you tell us a little bit what your feeling about is?
You are absolutely right, Mr. Flash. It is a very controversial topic, and there is no one specific guideline that regarding the effects of silver fillings versus the tooth-colored restorations. The American Dental Association has done studies, and they have not found any. The biggest problem, of course, is there are people who believe that the silver fillings, which they do carry mercury. Mercury is a compound inside of the amalgam filling, and many people believe that the mercury escapes and goes into your system. In the past, that may have been true possibly in the environment where the work was being done, specifically for the dentist. A lot of places had a lot of mercury on the floors and stuff. But the average dentist doesn't use mercury in that manner anymore. They're pre-capsulated. I personally don't use the mercury fillings myself. They're still a good restoration. They're cheap and affordable. On occasion, I do need to use it in areas that I cannot get isolation of the tooth for proper bonding with the tooth-colored materials. I just prefer using the new bonded materials for kind of like to protect the teeth a little bit better. You can be more conservative in your preparations. You don't have to drill away usually as much tooth if you need a filling because there's a chemical bond that connects the filling to the tooth versus the silver fillings need to have a mechanical bond where you need to then grind away more tooth to make the filling stay in the inside of the tooth. So my position is they're both good fillings. If a patient has very good older silver fillings and they're not leaking and they look intact, I recommend them to keep them intact and leave them that way rather than replace them unless they have aesthetic issues or the potential of the tooth fracturing where they may need to have the tooth rebuilt in a crown place. Then I recommend them being replaced. But if they're smaller, they're intact, the margins, the periphery of the filling is intact, I just recommend the patients then to leave them alone and kind of sometimes they'll last 30 years if they're done really, really well. So I don't recommend just taking them out, which some people do.
I see. So if it's then broken, don't fix it.
In a way, that's correct.
All right. Well, thanks for letting us know, Dr. Zymantas.
And you're welcome, Mr. Flash.